22 million Americans have a common but significant health issue, sleep apnea. It's when the upper airway becomes blocked repeatedly during sleep, reducing or completely stopping airflow. You stop breathing. What's lesser known is that children with Down syndrome are at huge risk for this condition. One of those children is Cassie Vanderberg. And as you're about to see, she joined a clinical trial to help her own severe case of sleep apnea.
Okay, you ready? Go. Cassie is a lot of fun. She's crazy and silly.
Constant movement and laughter fill Cassie Vanderberg's days.
She lights up a room when she comes in and people are they love her.
Yeah.
But she's a handful.
When you can get her to sit still.
What are we here to talk to you about?
About, like, things.
She knows the things, or thing, we are here to talk about.
Cassie was an extremely restless sleeper, all over the bed at night. She would end up in bed with me sometimes, or vice versa, and I just thought, how in the world can this girl be getting any sleep? Because it was so just all over the place all night. And a lot of snoring, and I would actually do this sort of stopping breathing and a big gasp. And so I started to figure that something was going on that probably needed to be checked. You know, hearing her stop breathing at night, to hear your child stop breathing at night, for a mom, it's very scary.
A person with sleep apnea, when they're sleeping, they're breathing in, and then, so they breathe in, and they breathe out, and before they breathe in again, they choke. Okay, so it's right at the onset of inspiration, right when they're about to take a breath in, the airways too collapse and they just can't, they meet resistance and they choke.
60% of children with Down syndrome have sleep apnea, periodic interruptions in your breathing during sleep. Emory Brain Health Director of Sleep Surgery, Dr. Raj Dedia.
And that happens over and over again, anywhere between 5 times an hour for adults, we say that, up to over 100 times an hour where patients are choking while they're sleeping.
In Cassie's case, her sleep apnea was severe, her tongue falling back and blocking her airway, common in children with Down syndrome. Dr. Nakila Raoul is a pediatric otolaryngologist at Children's Healthcare of Atlanta.
Most commonly we see is that their tongue is too big for, essentially too big for their mouth. And so with that, combined with that low muscle tone, it tends to flop back at night.
In this sleep study video from Emory, Cassie looks to be asleep, but her brain waves show she only sleeps 53% of the entire night. The continuous positive airway pressure machine, or CPAP, which sends a constant flow of airway pressure to the throat to keep it open, did not work for Cassie, who wouldn't keep it on. Sleep apnea can have profound negative impacts on health above and beyond fatigue. It puts you at a higher risk for high blood pressure, heart attacks, strokes, heart arrhythmia, depression, and early death.
And as they started talking to me about it, it sounded kind of wild.
It is Inspire, a surgically implanted stimulator to treat sleep apnea. A pacemaker-like device is implanted in the chest. It senses when breathing slows down and sends an electrical pulse to the tongue to stimulate it forward, keeping the airway open.
With Inspire, what it does is, as they are about to breathe in and during the whole inspiration part of the breath cycle, the tongue is basically protruding. So if they're sleeping at night, when they breathe in, breathe out, it relaxes, breathe in.
She was really the ideal candidate. She was the youngest patient that we implanted at the time she was implanted. So she was 10 at the time.
Already FDA approved to treat adults, Inspire is in a trial stage to treat children with Down syndrome. Children's Healthcare of Atlanta partnered with Emory Brain Health as one of 5 places in the country to be part of the trial. Dr. Dedia has already implanted Inspire in 70 adult patients.
The incision is made usually on the right side underneath the jawline, and we find the nerve that controls the tongue. That's called the hypoglossal nerve. Once we find the nerve, we dissect the nerve out and we put a small 10 millimeter cuff, wrap it around the nerve. And that's what allows the tongue to move, because we've got those nerve branches under the stimulation field. Then we put in the implantable pulse generator, which is really the pacemaker. That goes in the upper chest on the right side. And the third incision is bound by the rib cage, where we put a little pressure sensor that detects changes in the pressure of the rib cage area.
This video from Cassie's 2-hour outpatient surgery shows Inspire being activated and her tongue sticking out. That image signaled the change of her life and that of her mother's.
It's been a big change, a huge change for Cassie. Her breathing is quiet. I don't hear those gaps in breathing. I don't hear the loud snoring. It's just been amazing to me to know that that fear has been almost lifted from me now because she's sleeping well. It's just it's a noticeable difference for all of us, really.
Okay, just hold still for a minute.
A remote control turns Inspire on at bedtime. Whenever her tongue begins to fall into the back of her throat, Inspire stimulates the nerve to make it stick out instead, keeping her airway open. In the morning, the remote turns Inspire off.
And it turns white and it's on. You got it. Okay, yay! You won.
Cassie is more active than ever. For the first time in many years, she's also rested. So is her mom.
Cassie.
At her checkup, Inspire, which is Bluetooth connected, gives her doctors a readout of its use. Right now, Cassie is one of just 23 children with Down syndrome in the country to get Inspire, but makers say they're working with the FDA to make it broadly available to children.
When I offer this to these patients, I actually am confident that I have something that can probably cure their sleep apnea.
One thing is certain, this device
I love your TV.
is perfectly named for a girl who inspires those around her.